Welcome to the El Paso County Public Health Board of Health meeting, May 26, 2021. And we'd like to go ahead and get started, call this meeting to order. And just some notes here, both Diana May and Mary Ritchie are here representing legal. Kelsey Martin's running slides. Jared Verner is in the back for IT support. Jordan Linder will be taking minutes. And Vicki Bennett, of course, will be monitoring the chat and so on. Let's do the board member roll call. Let's see. Commissioner Bremer. Are you there? Nope. Commissioner Gonzalez.
Here.
In the room. Council member Yolanda Avila. You have Yolanda? Yes? No? Have we gotten any feedback from people remote?
Jared, can we see who the 18 are, the 19?
Yeah, make sure that we are not speaking into the void here.
I mean, ASL can hear us, so.
It says Candy Bremer has temporarily joined the chat.
Okay, so Cammie is here.
Cammie's here.
Councilmember Avila? Yolanda?
I don't see her on.
Okay. Councilmember Sam Geek is excused. Kari Gilroy?
I'm here.
Oh, good. Doris is here. Dr. Vu is here. Ted Colas is here, and I'm here. So we have a quorum. Thank you, everybody. The agenda should be in front of you, and barring any corrections or additions, I'd entertain a motion to approve. Second. All in favor?
Aye.
Okay.
Aye.
Board of Health comments. We've got quite a few things going this morning, so we're going to be fairly crisp. And what I'd like to lead with is that the El Paso County Board of Commissioners passed a resolution on May 18th that changes municipal board member selection, Board of Health member selection. And so this is going to affect us. We will need to affect a change to our Board of Health bylaws at some point. And it consists of three parts. One is appointments made by the Board of County Commissioners, term lengths, and reference to selection of members from smaller cities. So I'm not going to read it in its entirety. It's kind of lengthy. Commissioner Gonzalez, do you have any comments about it? You were there.
Sure. And one of the things we wanted to do was ensure fairness in the terms of the process, and so we wanted to make sure that the process for the large city that always has representation was closer to how we did the small municipality rotating methodology, which normally requested multiple applications and then approval by the county commissioners. And so we just wanted to make sure that those were aligned more closely to mirror each other from the one municipal Colorado Springs position to the rotating small municipalities participation or member. So we did that and cleaned it up a little bit, and I think it'd be more aligned. And then with that new process, as we saw, we have already selected a couple of new members doing great things already in their first month. So I think it was a good process that made things a little bit better.
Well, thank you. We're all in favor of clarity, and we will change our Board of Health bylaws to reflect the new guidance. Here's a fun part. I always enjoy this. We're going to do this early in the meeting. I'm sure these people need to scoot on out and get to their real jobs, but I wanted to talk briefly about Public Health Champion Awards, and we also call them our Public Health Heroes. And let me just read this part. Throughout the course of the pandemic, the team at Public Health has been inundated with new duties, from standing up an army of contact tracers to conducting case investigations to the Herculean task of coordinating efforts to get the vaccines in as many arms as possible. While our team is statutorily charged with leading the efforts, it has been the assistance from other county agencies, community organizations, and individuals that has really made the efforts successful. And so at this meeting and several future board meetings, we're going to be recognizing public health heroes. And Susan, I wonder if you wanted to go ahead and mention these people by name and what they've been able to do to accomplish.
Sure, we are doing 3 public health hero recognitions today, and we have 2 that are in person, and then we have 1 that will be joining us remote. And we will start with Daniel Garcia. If you would please come up to the podium, and would like to say a little bit about your efforts and in partnership with public health. So first, Daniel is a representative of the Pikes Peak Workforce Center, and we entered into an agreement with the Pikes Peak Workforce Center and Goodwill Staffing early in the summer of 2020. We urgently needed staffing capacity to respond to the pandemic. Daniel was assigned to help public health from the beginning, and his help has been invaluable. After just a few conversations, Daniel understood the role of case investigator and exactly what skills successful candidates would need to be capable of. He used a skills-based hiring approach to review hundreds of applications and resumes, and conducted interviews to assess the candidate's skills and gauge rates of success in the job. Daniel was even able to assess the Spanish-speaking skills of bilingual candidates, a high priority early on in the pandemic. To date, Daniel has helped identify over 50 people who were hired on as case investigators for public health, plus numerous other hires for the role of front desk receptionist, data entry, and administrative support. In addition to providing excellent assessments and recommendations for hire to public health, Daniel has had new hires take their mandatory trainings and coordinated an onboarding date with public health staff. Because of the time he spent and the commitment that he has given to our agency through the partnership, public health was able to quickly and continually build capacity for contact tracing while able to focus on the pandemic and not on the intricacies of hiring and the recruiting process. We are extremely grateful to you, Daniel. And also for Erica Romero, Daniel's supervisor, and Tracy Marquez, who is the executive director of the Pikes Peak Workforce Center, and for your continued help to support our agency. You are truly a public health hero, as well as many in the Pikes Peak Workforce Center. And we have a public health hero star that we have to give you. And we're going to wait until we take photos with everyone, but just to give you kind of a snapshot of what it looks like.
There we go.
And we'll take some
It's
photos
coming your way. Here we go.
We'll take some photos with the entire board a little bit later, but we are really grateful because it takes a lot of time and attention to ramp up, and we've ramped up our agency to about 267 staff, and we have a steady state of 158, and Daniel was a critical part in that ramping up, so thank you.
Oh, well, thank you, and it's really a pleasure to be able to, for our team, our practical workforce team, to support all the important work that you're doing for our community. So, anyways, thank you.
And next up, we have the Fountain Fire Department, Chief James Maxim, and the entire fire department for providing. I'll give him a little bit of time to come up here. Heard a lot of great things about you and your support.
Thank you.
For us, for providing voluntary emergency medical services support to many of our COVID-19 vaccine points of dispensing. EMS support is critical to oversee the observation area where those who receive vaccines wait for 15 to 30 minutes after to ensure that they don't have any adverse reactions or other medical event. Even though the fire department in Fountain was not always fully staffed, Chief Maxim assigned teams to support our points of dispensing, often with little notice, from February through April. We were finally able to contract with an EMS provider for these services, but that process took time, and we are extremely grateful for the Fountain Fire Department's support, your leadership when we most needed it. As you know, the purchase of the South Building and Fountain happened pretty rapidly, and we needed the resources available. And to date, we've vaccinated over 20,000 people at that site, and so that's, I think, pretty incredible, and couldn't have done it without your support. So thank you, Chief Maxim. And we have one for you too, and we can
present those in a moment. You want to mention our third recipient?
So thank you.
Thank you. We're glad we were able to help, and we're all one government together in this, so we were glad that we were able to help. So thank you.
And do we have General Sherman on the state call? Appreciate it.
General Sherman? General Sherman, if you want to raise your hand virtually.
He previously said he was...
I don't see him on.
No?
So what we can do is we can hold that to another time. He as you know, was the overseeing the state of Colorado's vaccine task force, and we worked very closely together, and I wanted to acknowledge all of his contributions to our team and our community. So I don't see him, so we can push that one to another time.
Okay.
If that sounds good. And then if we could have Daniel and anyone from the Pikes Peak workforce, if you want to come up and we can take a picture with the Board of Health.
Yep, so
Okay.
if everyone can get in front of this backdrop, Daniel, we'll have you in the center. This a little bit.
Yeah, this is a nice addition here. Instead of the clock picture.
Yes,
talking
yes.
Fire,
So let me know if that's for
like and then the fire.
Someone
the
edit that out.
Okay. So Daniel, if you can kind of get actually right where
where
Ted is standing, we'll have you in the middle.
There you go.
And then,
Thank you. Okay,
I
thank
can
you.
have you.
So nice to meet you.
It's nice to meet you too. Okay, well, thank you.
And where would you like to be? Susan, can you go between Commissioner Gonzalez and Dr. Vu? Let me see if we can get you all on the frame.
All right, nice.
Nice.
All right, so we will take several here. All right, I think we should be good.
Awesome.
If we could have, if you could come in the middle here. Thank you, Daniel. Thank you.
Good, thank you. Bring your star. Thank you.
Thank you.
Yeah.
And then,
I'll bring the star. That's a good idea.
and Susan, if
Here we
you
go.
want to go on that side then. Right here? Should you? Yep, perfect. Perfect, we'll do the same thing, we'll take several. All right, I think we're good. Thanks, everyone.
Hey.
Thank you.
It was nice to meet you.
You too.
So.
Take care. Thank you, Susan.
Thanks for coming.
Yeah, we'll, see you. Sounds good. Have a great day.
Congratulations. Thank you.
Thank you. Nice.
Thanks
Thanks so much. Nice to meet you. Have a great day.
Yeah, you too. And then here's this. Please thank Tracy for me too. You guys are
Today's our
awesome.
meeting today, right?
Yes, I think so.
The vaccine? Oh, somebody else. Okay.
Workforce
Hi,
Center.
Bob.
I'm going to run from the academy and leave and go to the workforce center.
Oh, okay.
I got to wait too many.
Back to back.
Back to back. Hopefully they'll be done with the flyby before I have to go to the 1 o'clock.
Yeah. Okay. Well, that's always fun, and more public health heroes to follow at future meetings. So let's see, an action item. We're back on track here. Need approval of the minutes. You board members have the previous minutes in front of you. Any comments, or I'll entertain a motion to approve?
Move to approve.
Second.
All in favor?
Aye.
I see a hand up. I think that is Councilwoman Yolanda Vila, and she's had her hand up quite a while. Did we miss you, Yolanda?
Yeah,
I'm
I just
sorry.
wanted to comment, that I've been booted off the island, so I'll only be here, I guess, till my last meeting should be in June. And really, really sad about that. I was looking forward to continuing my work with all of you and with Ted Collis and Dr. Vu. But nonetheless, I'll still be around, and I'll be attending the next meeting, and I'm sure that
Good.
Dave Donaldson will be attending too. But as a board member, I guess next month will be my last month, and I sure do want to set Dave Donaldson up for success and keep it a winning board. So that was my comment.
Well, we thank you for your kind comments, and we know that your devotion to public health will continue, and like you said, we'll continue to hear from you on these and other issues. So thank you, Yolanda.
Okay.
Let's see, action item here, finance and budget. I think we have Lori Cleaton on the line. Lori?
Good morning, board members. This is Lori Cleaton with Financial Services, and I'll be presenting financials you see there for April of 2021. Overall, the revenues, aside from the program-specific grants, most of the other revenue lines have been coming in fairly close to budget, so no real concerns there. In the program-specific grants area, this is where we've continued to dedicate resources to COVID-19 response, but we have the funding for the response in other areas as well. So overall, for revenues, we really have no concerns, and most is tracking pretty close to budget. For the expenditures, we're still showing underspending of funds that we appropriated into 2021 in both the personnel and operating areas, which you can see. And there's presently a positive net impact to budget of $629. So we have not been spending into reserves at all. And in addition, there is significant funding that we brought before you last month for immunizations, and we'll also be receiving significant ELC, epidemiology and laboratory capacity funding that will help in the COVID-19 response activities. In addition, El Paso County has received funds from the American Rescue Plan Act, and we are committed to allocating any money to public health in the event that there's not enough dedicated for COVID-19 response through the other grants that they've received. So that's kind of it in a nutshell. If there's any questions, I'd be happy to answer.
Board member questions for Lori? Okay, there are several items under finance and budget. I guess we need to approve the summary, or that's an interim document. Let's go to the contracts.
Yes.
Okay, first contract, shared risk and protective factor approach to substance misuse prevention. Go ahead.
Okay, this contract is a renewal. We did receive for this year an additional $36,000. This was formerly called the Communities That Care, so that's probably what you've heard it referred to in the past. And this project uses marijuana tax cash funds to improve the health of all Coloradans by reducing the substance misuse among youth. Again, this is just a renewal. And then the second one is the Tobacco Education and Prevention Partnership, also known as TEP. The funding for this did not change from last year to this year. It's for $719,084. And this is to support tobacco education in Colorado.
Good. Lori, could we back up a little bit? Could you mention the dollar amount associated with the Communities That Care?
Sure. Last year, we received $254,350. And for this next year, it has grown to $290,375. So just over about $36,000 increase.
Good. Thank you. Appreciate it.
Sure. And lastly, the tobacco education cessation connections in low-income multi-using housing in Colorado Springs, also known as TEP. This was a 3-year grant that was scheduled to end in June of this year. And so that contract is ending. That was funding of $190,456, and that's ending this year.
Good, thank you.
Yes,
Board member questions on any of these contracts?
I have a question.
Yes, please.
So with the peer tobacco cessation connectors in low-income multi-unit housing in Colorado Springs, will that continue under some other, since we don't have the funding for it, is it still going to continue?
I don't have the answer to that. Deanne or Daisha might know that.
And unfortunately, I mean, this was kind of a short-term grant. And when the grant ends, we do evaluate to see if we can continue the work. But at this point in time, I don't foresee that we're going to be able to do so.
This is Daisha. I'm the program manager for TEP. Some of that work will be able to fall into our core grant. And, you know, we've established some really great partnerships with the Housing Authority here in Colorado Springs. And so we will provide as much support as we possibly can. It just won't be in the same capacity as it was when we had that dedicated funding.
Okay, thanks, Daisha. Other board member questions? Yes, Commissioner Gonzalez.
I would say that as we look at what is eligible or not eligible for the American Rescue Plan dollars, that if you have one or two prioritized programs that maybe are ending dollars, there could be another 1 year perhaps extension based off of, wouldn't be one-time dollars, but maybe perhaps extend something for another year. But again, I would just prioritize one or two things. That this may not be it, but I'll let public health determine, and if they're eligible or not, I don't know. But we'll be finding out here pretty quick what's eligible or not for funding, and just keep that in your back pocket as something perhaps that makes your list.
Yeah, and I would say, thank you, Daisha, for your input. I think, we always try to work through partnerships and to be supportive as possible. And sometimes the attention that we would want to give certain aspects, we don't have limitless resources and human resources, but we do all we can. And as we do some adjustments overall with our agency and our focus as it relates to the response currently is less intense than it has been for the past 15 months, that we are doing a lot of assessing, reevaluating from an agency standpoint, because we went into continuity of operations and now we're in that starting to adjust. And so Commissioner Gonzalez, thank you for pointing out the American Rescue Plan Act, and we do have some ideas for that for the response and recovery still of the vaccine distribution and rollout, but we will be having those conversations with our entire agency, because no program really has been unaffected throughout this pandemic, and we need to see what that future looks like in our grants and our funding, and so there's still a lot of work to be done on a broader scale.
That's great. That's good news. So, barring any further questions or comments, I think I could entertain a motion to approve all three of these contracts.
Dr. Terbish, this is Commissioner Brimmer, and I would love to move approval of all three of these contracts. And I would just also like to thank Daisha and her team for steering the course and navigating. You too had to pivot during COVID, and I understand that that's a particularly difficult thing to do when it's a state grant program that you're running, or originally started as a state grant. And, when the state has to shift priorities, it entirely affected your program as well. So thank you for keeping the ship rowing forward and looking for unique partnership opportunities, and still using even a limited amount of funds to get to the bigger picture of truly affecting what tobacco use looks like in our community. And I'm looking forward to seeing some creative partnerships continue with the education work and groundwork that you and your program have already laid.
Thank you, Commissioner Bremer. So we have moved to approve all three. Do I hear a second?
Second.
All in favor?
Aye.
Okay, let's move on to number 7, which is the postponement and a rescheduling of the public hearing regarding changes to on-site wastewater treatment systems. And move to schedule a public hearing on June 23rd, 21. Mary, do we need to have any legal advice on this, or have we got this covered?
We have it covered. I just would like to say that according to El Paso County Public Health Regulation, Rule 2.11, point I, Administrative Procedures, on the date, time, and place stated in the notice for the public hearing, which was today, the Board of Health may cancel, postpone indefinitely, or continue to another date, which shall be announced here, or take other action as appropriate. So we do have the board does have the legal authority under its regulations to continue the public hearing.
And let me just make a quick comment by way of explanation, is that these major policy decisions affecting both a fee and an administrative requirement will always need to be matched with a commensurate increase in customer service. And so that's what we are trying to do here, is to make sure that we line up our ability to regulate and provide customer service. And that's why this hearing has been rescheduled. Okay, I don't think there's any action other than that required. Director's report. Susan?
Okay. Before we go into the COVID update, I'd like to provide a legislative update.
Oh.
And so I have some exciting news. However, I think it's very sad that we've had to pass a certain bill for the protection of public health workers this past year. But I will say that it's gained, through the committee's unanimous support, and the governor signed the bill into law last week. And I was on the call, I was invited, but unfortunately, since I was on an iPhone, I couldn't speak. I was part of the process as it relates to testifying to the committees. We had Representative Terry Carver, who sponsors the bill, as well as Senator Lundeen from our area, which he's another sponsor. And to refresh everyone's memory on what this bill entails, it's House Bill 21-1107. This bill protects the personal information of certain public health workers of the Colorado Department of Public Health Environment or county or district public health agencies who are engaged in specific public health duties. This bill also allows eligible workers to submit a written request to state or local government official to remove personal information from public records that are available on the internet. Personal information includes their home address, home telephone number, personal mobile telephone number, personal email address, or personal photograph. Current law protects or provides these protections for law enforcement officers, human service workers, and their families when dissemination of personal information poses an immediate or imminent and serious threat to the safety of the public health worker or their family. Violation of this prohibition on sharing of personal information is a Class 1 misdemeanor. And I think that many of you throughout the pandemic have been aware of what our agency has experienced as it relates to the volatility. And when we care about people, and that's why we entered this job. But there has been a lot of volatility as it relates to carrying out our statutory responsibilities in serving the public. And around the state of Colorado, there were a handful of public health directors that did testify. There were also protests outside of one of the public health worker directors' home personal home in Colorado. There have been vandalized buildings, vandalized vehicles, and we also have experienced just elevated concerns and tones. And so I commend my team for staying professional through it all. However, this bill will provide some protection, and I think that this is, with the governor and the support of our elected officials is really important, and it says to me that they see public health workers, that they care about us and our safety as well. And I know that the Board of County Commissioners also have done all you can whenever we went to present in making sure that a lot of any of the volatility was shut down, because we're trying to carry out our responsibility in our job. So I think that's exciting that we have that type of it's major support for public health workers. And so that's one piece of the legislation. And then there's another bill that is in the works right now, and this goes to supporting infrastructure of public health. And I'll talk a little bit about the investment for local public health. As you all know, that the state per capita funds every year provides around $800,000 from maybe 2008 per year to about $900,000, so just under $1 million. Last year we received $1.1 million from the state budget, and that money is to carry out our statutory responsibilities and core services. If you think of a population that is 748,000 people and state funding that is under $1 million, think about that a bit with, how supportive is that to carry out our duties. So this bill would provide 3 consecutive years of funding, and it would be on a per population basis. So with our population, I would anticipate that we would get around $1 million. And some of the challenges that have not went away that we've continued to address and will still need to continue addressing is the county's population has increased from 599,000 in 2008 to an estimated 448,981 in 2021. That's a 25% growth. The health departments around the nation that serve 500,000 to almost 1 million have an average number of employees of 269. We have a steady state of 158 in full-time employees. The demands have increased for services all over in all areas. Capacity to respond to emergent issues such as deploying personnel in response to the COVID pandemic or any other threat. Many grants are time limited. Reoccurring funding remains flat. 74% of our revenue is restricted with grants and contracts and fees. And state funding for core services has remained flat for almost a decade. So we'll need to stay, steady and advocating for the additional funding. And it has passed through the Senate, and now it will have a hearing in the House. And I have reached out to a couple of our House representatives. I was able to connect with Tony Exum yesterday, but I will continue to do so. And I would say if there's any questions that we can answer on what this bill would do for local public health infrastructure, I'm happy to answer any questions throughout this process. The legislative session will end here soon, so I think that we need to act quick. And I do have a fact sheet that I will send out. But it's as the demand goes up for local public health and statewide public health, we need an infrastructure that supports our efforts. And so this is an investment at the state level would be to our agency as well as the state health department and agencies throughout Colorado to have a more robust and proactive and able to respond to all of the core needs. But then also we know that there's emerging threats out there that we don't even know about. And think about when we had hepatitis A, it takes all hands on deck. And And my goal would be to maintain and retain much of the staff that we've ramped up that we have, because we need them. And so this is all part of a strategy to gain additional funding and have a long-term investment. And I will say that the county commissioners in 2019, if it wasn't for your support and giving us additional funding, as well as the Board of Health taking some of the reserve funding to hire the additional 10 FTE, we would have not been able to respond as well as we have with COVID. That funding, just a portion of that supports our data and analytics office. Can you imagine, as Yolanda Avila calls them, the dynamic duo, Stephen and Fadi, can you imagine a response with us being blind and not having that data dashboard and the transparency with the public? So those are the kinds of things that and aspects that we can do with additional funding, as we can really serve the public that produces great long-term benefits. So that's something that I think is exciting that is being considered.
Susan, can you clarify, is this an additional $1 million?
Thank you. So we currently receive about $900,000, and this would be an additional funding to local public health, and they'll do it on a per population basis. And so I'm thinking, and maybe Nikki or Lori can correct me if they know more about this bill than I do, but it would be about $1 million, since our population is one of the largest, if not the largest, when the census is done.
And it's for 3 years?
It's for 3 years, but we've had a steady presence with public health transformation through all of the public health directors in the state health department and those engaged in public health, that we need sustainable funding. So this would be a great start for 3 years. So that's the update, and I'll let you know how that goes. And I don't know if anyone else has any other legislative updates.
Any other Board of Health member comments or questions? Yes.
I'll just say it's very good news, and then I just wanted to acknowledge that I think Dr. Turbush was the strongest advocate for increasing that reserve that was greatly needed in 2020. So thank you for really being the champion for that a few years back.
So with that.
Oh, we have a hand up?
Do I have?
Councilwoman Avila.
Oh, hi. That's super exciting. And Susan, if there's anything I can do, go testify or whatever, I'd be happy to do so. We're under-resourced, and we need to get there to serve all of the El Paso County population.
Thank you. I appreciate that.
Thank you. Okay, go ahead.
All right, so now on to a COVID update. We have been doing a road show and going to different municipalities and elected boards. We went to the Board of County Commissioners recently, and then Colorado Springs City Council will be reaching out to the city of Fountain here soon, and other municipalities. So with that, we're going to condense our presentation, because I feel like a lot of it has already been out there, and you guys are part of the vaccine consortium, and we do a lot of communication through email. So we're going to hit just some of the highlights today with the COVID update and answer any questions. And Fadi Yokahana, our epidemiologist, will do the presentation.
Good morning, everyone. Good to see you in person. See smiles in this beautiful Colorado morning. Just a brief COVID update. Since May 1st, our incidence has been trending down. We lost about 75 to 100 incidence points. Really exciting. We want to continue that trend down. We remain one of the higher incidence counties in Colorado, but it is trending the right way. We had a little bit of a hiccup on May 24th as the state introduced a bunch of backlogged cases. So we saw a little bit of uptick, but the trend is going down. Our positivity even went under 5% for the first time in a really long time, which is great to see, and we hope that continues. We're starting to see evidence of the vaccine taking effect on the incidence. We see the ages of the cases trend younger. We're seeing a shift in hospitalizations trending younger as well. And our deaths have, the average age has reduced by 10 years, which is an incredible drop in the average of age. Moving on to our vaccine update. We did see a little bit of an uptick. We were plateauing on the number of new people coming in to get vaccinated, but most recently we saw that go up. Maybe that's due to the 12 to 15-year-olds becoming eligible. Maybe parents are taking their kids and they're also getting vaccinated, but that's really exciting for us to hear. We are at 53% of El Paso County eligible population being vaccinated. I do want to point out that we often get lost in the numbers. We often revert to pass-fail binary kind of interpretation of the data. The fact that 53% of our population eligible population has been vaccinated is a wonderful thing to say out loud. The fact that last year we were dealing with a new virus and now we have 1 in every 2 eligible people in El Paso vaccinated is wonderful. It's not done, of course. We want to improve that, but that is something that is worthy of recognizing. A very brief update on ages. Our 65 and above population, with state data only, we're at 78%. But if we include the federal partners, we estimate that to be between 80 and 85% of that population being vaccinated. Again, an incredible number to say out loud. The 40 to 64 reached the 50% mark. So 1 in every 2 of the 40 to 64 have also been vaccinated. And now we're starting to see the 12 to 39 population also to increase their vaccination numbers. Okay, we can move on to the PowerPoint update. We wanted to update you briefly on some mortality data that came out of the state. The state COVID system database was updated to include 2020 numbers. COVID came in as the 3rd leading cause of death in El Paso County. That's consistent with state ranking as well as national ranking. Happy to report that in 2020, and before I go on to the numbers here, we do recognize that every single death is something that our community suffered through, and it's a tragic event. So we do not want to look at these numbers as just numbers. These numbers have families behind them, so we want to recognize that before moving on. El Paso County in 2020, in terms of deaths per 100,000, ranked in the lower half of that top 10 counties. We were below the state average. So if we adjust for population size, we did better here than the state average, and if we use Denver as a comparison, which is something good to know, that our community responded to COVID and that we kept those deaths below the state average. A little bit of a cautionary update, 2021 is not looking too good. Well, we are having more deaths, and what we're seeing happening now is a strong correlation between a higher percentage of vaccinated and a decrease in serious illness. So when we look at the 2021 mortality data, we want to keep this ranking and improve it. And the way to do that is to increase our number of people vaccinated. Next slide, please. I'll give you a little bit of an update on the variance of interest and the variance of concern. The variance of interest now, you'll see that the CDC is starting to look at and watch the India variant. 4 of the listed variants of interest are coming out of India, and we're learning more and more about these variants. As you've seen in the news, India was struggling a lot with their hospital capacity. Their hospital system was getting overwhelmed. It does look like their wave is plateauing and maybe decreasing, which is great to hear. Next slide, please. In terms of the variants of concern, that's the sort of the next level of seriousness that the CDC categorizes. We have numbers up here for El Paso County. The B117 found first in the UK is the dominant variant in Colorado and the dominant variant in El Paso County. But we do have cases of the B1351, the South Africa variant, the pair of the California variants, and the P1, the Brazilian variant. Now, these numbers are not a hardline number. Sequencing happens on a 4-week cycle, and that bulk that we talked about earlier of the cases being backlogged, that was a result of sequencing by the state. So these numbers are not a true reflection of the picture in El Paso County. They're just what we have on. Next slide, please. And this graph is just a very simple way of looking at the tug and pull of the variants. That gray line in the background, that was the original strain. The blue line, the dominant line that it is now, that's the UK variant. And you can see visually that the UK variant is now the dominant variant here in Colorado. That's it for me. Happy to answer any questions.
I want to just ask you a couple of questions for clarification for the board.
Yeah.
So when you, could you talk just a little bit about the data dump that happened on Monday and I think yesterday?
Yep.
Just to put the numbers in perspective, because I think that, you know, when you see that on our data dashboard, you might think, oh my goodness, like what's occurring, but could you just clarify that for everyone?
Yeah, so on a daily basis, when we do the update, we usually see between 150 and 200 cases, depending on the day, and that number is going down. On Monday, when we did the update, there were 480 cases, and now it's grown to around 525, a little bit more than that. So we were concerned. We thought maybe there was an outbreak, but we investigated, and our team is investigating. We heard from CDPHE that that bunch was a result of a backlog in sequencing, and yesterday's numbers were 170 additional cases, so it's reverting to that normal flow. So that bump may be artificial. We hope it is, and we'll keep you updated.
Okay, good. Thank you. Yes, Commissioner
Can you provide a couple of slides where it shows the ages, I thought?
Oh, yeah.
The ages of demographics. I think it's a different.
This one?
Yeah, and I'm wondering if it coincides perhaps with our marketing. So if you slide back a little bit, you can see where it's plateauing, and then there's an to the right further, a little bit more, right there. You can see where we were plateauing, and then we got a little bit of an uptick on getting people. Was there anything noticeable there? Was that like when we started the marketing or something?
Yeah, Michelle can probably fill us in a little bit better. Susan's pointing to our pins.
I can speak to that. So I would say, yes, that's made an impact as it relates to the Vaccine Consortium's effort. And then also we worked with the City of Colorado Springs, Michelle and Jared with the Don't Wait, Vaccinate campaign. But I think one of the key strategies that we've invested in is with the Vaccine Consortium is going out and meeting people where they are. With the mobile vaccinations. So that has really, I think, significantly contributed as it relates to keeping the momentum up. We've been going to sporting events. We were at the Switchbacks home opener this past weekend. We were attending different events like the First Friday downtown. We have partnered with all of our schools that want to, and I know that we had a great success at the Cheyenne Mountain school of 150 the first go around, and then we had 300 that were available the next go around to do first doses. We're working with Sierra and Pikes Peak United Way at the Mitchell High School, and where their food distributions are happening. We're working with, I think it's Friendship Baptist Church or churches. So I think that the mass vaccinations paired with also the clinical trusted physician offices like Dr. Vu's office, paired with the Colorado Springs Fire Department doing the homebound vaccinations, we really brought it together with the entire, all of the efforts hitting on all cylinders. And I think that that's what we're seeing paired with the Don't Wait, Vaccinate campaign. And I did want to say that we do have these buttons if you're vaccinated and if you're interested in wearing one, that we will be handing out, and I'm wearing my button today. So there continues to be a lot of momentum on that front. And Michelle, I don't know if you have anything to add, but I do think that it, to your point, you're right on target.
It's kind of subtle, but it's not insignificant. And I just want to identify what were the things that we're doing that had that.
We did officially launch the campaign at the end of April on the 26th, and so end of April and early May is when a lot of those efforts have come to fruition. With our billboards are up, we've got our bus ads running around town, we've got print in the Southeast Express, paid social media. So I do think that campaign launch, in addition to everything that Susan had mentioned with all of those strategies, I do think it's helping to increase our numbers.
So. And radio ads, bilingual radio. I mean, it's been really a full force effort. And I did ask, Fadi to provide the 2020 metrics related to deaths, and that information just became available. And so wanted to highlight there, because all throughout the pandemic, we look at evaluating in different metrics on how we're doing and the impacts to the community in El Paso County and how we're performing. So I think that is something that is noteworthy.
wanted to make a comment on Robin Johnson, Medical Director of El Paso County. I want to make a comment on Fadi's statement around the impact of our vaccines and that we have been seeing a real decrease in the age in which people are contracting the disease in our incidence, but mainly that hospitalization and fatality. It is profoundly demonstrative of the impact that our vaccine can have and why it's so important. The cautionary tale here, though, is we still have hospitalizations and we still have fatalities. It's just that we've shifted that 10 years younger. And so the longer we wait to get vaccinated, and this is like part of that imploring our community to join us in this effort, is that we will continue to shift that age younger. This disease has a way of evolving and finding that open door for it to continue its own life cycle. So if you're not vaccinated, you're the fertile soil for it to grow. So please join us in that vaccine, help us keep these death rates down, and help us have a more productive 2021 as we look forward. So thank you.
And with the governor's announcement yesterday as well, I mean, there's significant financial incentives and opportunities for people to win $1 million if they've been vaccinated. And I do think that there's going to be some more incentives that will be happening along the way to increase vaccination rates. And I know that, looking at other communities and states that have had some type of incentive, that they have significantly increased their vaccination rate. So I think that we're making a lot of progress, and I do want to emphasize, and I say this all the time to the news media about the vaccine consortium, because this is not public health in a silo. This is the entire vaccine consortium, the 3 hospitals, UC Health, Centura, Children's, Dr. Vu. I mean, you've been actively involved in the fire department, and Walgreens, the pharmacies, there's elected officials, Commissioner Gonzalez. I mean, there's, Councilwoman Avila, Dr. Chirbush participates, but this vaccine consortium that has been meeting every single week to, talk about clinical operations, but then also strategies and how we're pivoting moving forward to continue making progress. I can't underscore the vaccine consortium enough, and I wish that the news media would pick up on that vaccine consortium, because that is the collaborative that has bound together to really demonstrate the success that we're seeing. And that includes, many medical directors and CEOs, and it's a great group. So I do want to underscore that, because anytime I see something that I'm involved in with the media, the vaccine consortium doesn't really get a shout out, but that's the collective impact and progress that we're making.
Can I have a comment, Rick Vu? Yes. So one of the barriers that I have found, at least in our practice, is that not all of our physicians and providers get the vaccines themselves, and not all of our providers are acceptant of the vaccines. So I'm wondering if it would be, one option is to, as we continue to focus marketing to the public, maybe shift a little bit of that focus on healthcare providers in the community. And that would be fruitful to do that.
How would you suggest we might go after that? Doctors are a wily bunch. And, how might we? I think it's an excellent idea, and of course, huge influence. Primary care physician probably has the greatest influence over whether or not people get vaccinated. How might we approach that?
Yes, I think that's a great question, and I don't have the answer to that question. Obviously, I have not solved that problem in our practice. Part of that is I'm in the trenches sometimes, and I'm out of the trenches other times, and I don't truly know the mentality of physicians who are in the trenches all the time. So I don't have a great answer to that. But I think if we can figure that out, how to convince physicians and providers to be acceptant of the vaccine. But I apologize, I don't have a good answer to that.
Well, that's a mighty big question.
Great question for the vaccine consortium.
Yeah.
The CDC did a survey and found that physicians, I think they were third most trusted source, and that sort of led to our efforts focused with getting vaccines in partnership with physicians. So it is something that the data is showing as well.
Let me just go ahead and say that I think, unfortunately, we are learning some of the wrong lessons from this pandemic. Two of which are, first one is, unfortunately, a kind of a pervasive and pernicious anti-scientific attitude. These mRNA vaccines are our generation's moonshot. They have been around for 10 years, but just now really come to the fore. And I think history will look back, science will look back and say this, as Dr. Johnson said, made all the difference. The vaccines, in addition to the other protocols, made all the difference. And so I would address that, a pervasive and pernicious anti-scientific attitude. The other thing that is I think we're learning the wrong lesson on is that people may come away from COVID as horrible and devastating, personally and economic as that this has been. People may come back and say, well, it wasn't that bad. And time, tends to affect people's opinion that way. But in fact, there are bad bugs out there, worse than COVID, and a outbreak with a mortality of 5, 10, 15% is not unheard of. I mean, we saw it, 1918, that was the percent mortality. So I hope that, and am concerned that we as a society are going to look back at COVID and say, well, knock that one off. It's not that bad. And then when the next one comes around, which is inevitable, we may not take it quite as seriously. So anyway, from my corner, I think those two things may help. I don't know, but may help physician attitude a little bit.
Along with that, Dr. Tabush, I think one of the potential benefits of this COVID-19 pandemic is in the future we might have a way to have less deaths from other respiratory infections such as influenza, RSV, etc. So we will hopefully we'll have better ways to decrease transmission of other respiratory infections.
From the new technology, the mRNA
vaccines and social distancing, etc. protocols.
Excellent. Well said. Commissioner Bremer, you have your hand up, please.
I do, thank you. I feel like I said this a little over a year ago about the hepatitis outbreak that we had. The difficulty and yet the thrill of the work that public health does, and that all of you as individual providers and community members, is that the work of prevention can't always be measured. We won't know how many lives were saved. The only numbers and data that we have to go off of are the rates at which we are improving the vaccination rates. And I just want to say, as a bit of encouragement to that, those numbers that we don't see, the numbers that we don't see in terms of numbers of death, realize that the efforts that are taking place, that's really what's impacting that. And so, Dr. Turbush, as you talk about, as we get further down the line and people say that wasn't so bad, I would continue you as public health advocates to continue to point out all that was done in terms of prevention is not always measurable. And I know Daisha from the tobacco program and others, all of you in public health work in different areas of really prevention and education. And you're planting the seeds now that you don't know when they'll take hold. You don't know truly what effect they'll have. And as public health, we love to look at the data. In the medical world, we love to look at the data, but it's really, really difficult to measure the lives saved and the prevention piece. So I guess I just bring that up as a bit of encouragement. And I really like Dr. Vu's point about the providers. I think, I don't know if that's the county health department's role in that. I look forward to hearing how those consortium conversations go around that. But I think realize too that, you know, you are community leaders, and you are, as providers, you're community leaders. And there are so many people that maybe don't trust everything they're hearing about a vaccine or about other prevention measures, but perhaps they have a great relationship with their primary care physician. Perhaps they have a great relationship with someone in the medical world that they do entirely trust. So that's where I think that kind of a campaign is probably worth talking about.
Thank you. Absolutely spot on. I always appreciate your perspective and positive look at that. Thank you, Commissioner Bremer. Any other Board of Health member comments or questions at this point? We've been pushing on for a little bit. Is there, no? Fadi? Thank you.
Thank you. Thank you, Fadi.
Thank you, Fadi. Okay, Susan.
And that's all I have for the director's report.
Okay. This next part is for public comment. Do we have any members of the public that have dialed in or indicated that they want to speak to us today? Okay. We're okay? A surprise visitor today. Todd Evans.
Oh, that's me.
There we go. Deputy City Manager of the City of Fountain. Please. Todd.
Doctor, thank you. Before I get onto the what we would like to commend someone from the Fountain, I'd just like to speak personally to all of you. We at the city would really, truly like to thank each and every one of you. And a lot of the faces on the board have changed in the last year as this was going on, and I've been lucky enough to come into the board a couple of different times. But we just thought it was the right time as we start seeing a ray of light in this situation to come in and hopefully motivate a little bit, but to thank everybody on the Board of Health as well as the team at the Health Department. You all have given us, as municipal leaders, you all of us have given us the top cover, I want to call it, during this pandemic. And what you've done is you've allowed us to follow your guidelines. You've allowed us to follow your lead. And think about the difficulties that we've all dealt with for the last year. But let me have you mentally visualize, what if us as community leaders didn't have you leading us and be the tip of our spear? What if we're all out there making our own individual decisions and why don't we try this and why don't we do this and why don't we do that? Think about the effect of all of our clients that would have. So we internally talk quite often, and our comments is when people ask us, why are you doing this? Or what are you going to do? And we say we're going to follow the lead of El Paso County Health Department. And how much top cover does that truly give us? A tremendous amount. And it gives us consistency. Because what if Fountain was doing something different than El Paso County or Colorado Springs or Calhoun or Green Mountain Falls? It would really be a crazy region. So we just wanted to come as we have that ray of light and thank you. And that's everybody on the team. That's everybody, because you all have done that for us. And I don't think you've heard that enough in the last year. And personally, and I will get a little emotional because I've been through these things and retired from law enforcement. I learned my first long-term incident command was for the Hayman Fire. When I was the incident commander for law enforcement for El Paso County, that was just a couple of weeks, right? And I felt personally how that affected me and how it affected our team, and helping with the Waldo fire, how it impacted Rich Brown, who kind of was the tip of the spear for that and how it affected them. So we got used to handling critical incidents, but they most happened for hours. Capture the Texas 7, we were done in 36 hours, right? But everybody around the nation, how great that was, how you did that, what happened. Ted's been through Waldo, he's been through Black Forest, he's been through a number of those. But think about, you all have been in a critical incident for over a year. and the personal impact that has and how it impacts your family. And that's what makes me emotional, because I just have so much respect for all of you all for doing that. And Dr. T, you've been here and you've been on call. I've called you. And you pick up the phone and answer any of those things. So just to every individual on your entire team, I hope I can express how grateful we are for what you're doing, what you're still doing. But we have that ray of light. So it's my pleasure to give a commendation to the person who has been at the tip of the spear, and that's Susan. So I'm going to read what we put together for the city. On behalf of the City of Fountain, I would like to commend Susan Whelan for the outstanding job she has done serving as Director of El Paso County Public Health, and convey our thanks for her strong partnership and support for the Fountain community. Over the past many years, Susan's leadership, dedication, and collaborative approach have contributed greatly to protecting and improving the health and well-being of our region. In Fountain, Susan and her team have worked closely with local leaders and city staff on numerous initiatives and projects to include programs focused on behavioral health, suicide prevention, anti-smoking campaigns, children's well-being, and most recently a wide variety of activities to fight COVID-19. Leveraging her local knowledge and experience, Susan has also led a much-needed effort to bring community health resources directly to the Fountain Valley, acquiring and developing the new El Paso County Public Health South location in Fountain. This new resource is a tremendous asset to our area, offering critically important services to an often underserved population in the region. As a result of her teamwork and proactive approach to improving the lives of her fellow citizens, we now have a first-class facility that provides COVID testing, vaccines, WIC support, veterans assistance, and many other health services to over 100,000 residents, all at a close and convenient location to those in need. We wish Susan and the entire Department of Public Health team continued success in their tireless efforts to serve our region, and thank her again for her steady leadership, stalwart cooperation, and continued contributions to the betterment of Fountain and our neighbors throughout El Paso County. Sincerely, Gabriel P. Ortega, Mayor of Fountain, Colorado. So, Susan. On the board. Oh,
nice.
Eloquent as always. Yes, we appreciate it.
Todd.
So that's, and I can tell you personally, I've been down to that location for 3 tests and 2 vaccines. So it's just wonderful having it down there, and we appreciate y'all.
Well, we appreciate you, Todd. We appreciate the City of Fountain. What a great cooperative relationship that has been.
You bet. We love it. Thank you all, and thank you for giving me the time. Okay, take care.
Thanks again.
Thank you, Todd.
You bet. Bye-bye.
Those are nice surprise visits.
Well, yeah, those are very welcome to our entire team.
Absolutely. Absolutely.
Those kinds of visits.
Okay, well, I think that we have come to the end of the regular board meeting, and we do have an executive session scheduled. So our county attorney, Diana May, is, well, let me stop here for a second. We've driven on pretty hard. Any other Board of Health comments or questions before we go into this next?
Dr.
No?
Kerbish, sorry.
Yes, Tammy, please.
Thank you.
I was worried we'd driven on too quickly at this point, so please, go ahead.
I just quickly wanted to say thank you for your patience, as I am out of town this week, and glad that I can still join you, but really, I think it's super important that we do all get back in the same boardroom, and I look forward to seeing your faces in person, and I'm sorry that could not happen this week. Thank you.
No problem, thank you, and I too look forward to getting back together. It's already better with no mask today. Our county attorney, Diana May, is here, and I think she'll lead us into executive session. Can you give us some help with that, please?
Absolutely. Good morning, Diana May, County Attorney. There's a request for executive session pursuant to 24-6402 4B regarding personnel matters pertaining to the annual performance review for Executive Director Susan Whelan. And my recommendation is that we take a vote to go into executive session, that we close out this public meeting, we stay in the board in this room and do a executive session, and then we can go back on to the public meeting to exit from the executive session.
Very good. Let's see, I need a motion to go into executive session, please, in a second.
So moved.
Second.
All in favor?
Aye.
Thank you.
And so we just need to make sure we close out this, and then,
Okay.
we'll just politely ask anyone who's not part of the board to go ahead and step out, please.
Okay, we'll take a little break. Thank you. Okay.